Cindy is a key member of the staff at Mary Immaculate in Mundare.
Cindy is very organized. She facilitates everybody in the facility. If anybody has a question, we go to Cindy.
I use collaboration in my work. I work for 5 different managers.
If the floor is short-staffed with NAs and not enough nurses or girls to feed, she'll stay and feed the residents supper, and then she'll go.
Whether it be on a snow day, if a staff member doesn't show up, I'll stay and make sure that everybody's okay, or if they need help serving coffee, or I'll stay and do my best.
The CLXT program is a combined lab X-ray program to train the students from NAIT to be able to meet the challenges of the job.
With NAIT, we have to communicate back and forth to make sure that the students get all the practice that they need in different areas.
Well, we all work as a team. Each of us probably has our strengths and weaknesses, which probably is a good thing, because that way we can put forth our strengths and the students actually get the best of both worlds.
We work together to make sure that the student gets everything that they will need to be able to face the challenges at the end of the program.
I'm really proud to be the lead for the Medicine Service Excellence team. We got together as a large group, recognizing that the work with patients on medicine is interdisciplinary and very collaborative in nature.
Sometimes we try to do things independently, but you get a lot more quality work done when you work together with other people. The education material that we put together focused on the 7 ROPs that we had for the medicine accreditation, as well as the standards that were outlined.
Some of those things that in the past we might have viewed as a threat or a barrier are no longer there.
We received the highest accreditation decision possible. We were accredited with exemplary standing.
Hassan is an LPN that works at St. Trace Villa. He's very passionate about the residents that we serve, and it drives everything that he does. He creates a space for people to really work to the best of their ability, and so he collaborates by knowing his staff really well and having good insight into what makes them work hard.
Collaboration means, teamwork. You work together as a team and you have a goal to achieve, and you achieve it all together.
He's so busy dealing with the residents and focusing on them that he's really not looking back to see what people are thinking of him.
Every single day you have to have like a mission, you have to have a goal. My goal is to come here to do my job and offer the best help as I can.
When you look at collaboration, it's really not about Oliver and I, it's about all of us. It was a great team, it was fun working with them.
Our rural group is a wonderful team, basically. We come across wonderful people out there.
As we look forward, we know now that the Alberta government has actually mandated by 2015 that they want all reprocessors to have the certification. So, we're already ahead of the curve. I know others are actually following our lead.
Our accreditation efforts are done, but the collaboration continues, and that happens almost on a daily basis, where we help each other out with answers to various questions.
In terms of collaboration, Oliver is collaboration. We tasked him with taking over both MDR departments, one here and one at the Grey Nuns Hospital. He did that, it seemed like seamlessly. I'm sure it didn't feel like that from his point of view, but from ours it did.
He's very kind and cares a lot about his staff, and wants them to work well together.
I'm blessed to have a very good team. I work with excellent immediate reports at both sides.
I love having him on a team because essentially I know that he's going to find unique and creative solutions to problems that we have. He's got that sort of mastermind approach about him. He's always doing something for a reason.
He is leading the way by being an excellent role model and showing us that it can be done, and it has been done, and it's working.
One thing you'll notice about Regina is she's very calm. So when it comes to seeing what's best for the resident, she works with all the disciplines, sits down with them, and we see what's best for the resident, and she's willing to flex anything that she offers around that.
She works well with everybody, with all teams and with all team members.
If it's nursing, she has a way to work with them.
I cannot do anything by myself. I need the collaboration of different disciplines and my co-workers.
She's able to find time for other things, like if OT needs her help, she will go there and help them.
I think collaboration is very important in the healthcare field.
I think that all hospitals work under collaboration practice. I don't think any department is a standalone department, but I really think that St. Mary's excels at it.
They're extremely positive. There's nothing that they won't do or won't attempt to do.
Our common goal is the patient, and how can we best serve the patient, and where can we best serve the patient.
There's nothing you can give them that they won't come together and figure out. Like, you know, they received a phone call asking could we take the bariatric patient back, and right away the answer was yes. And they came together and, you know, they phoned everybody across the province that they could think of that could help them. You never doubted for a moment that they wouldn't make it work.
Coming together is the beginning, but working together, you know, it's the result of it, right? It's like I thought to be a manager that I have to be there to tell them what to do, but they surprised me. I'll be making a plan, and then before I say it to them, they said, "Oh, we've already decided on this is what we're gonna do," and I said, "Oh, you don't need me here then."
It's not an acute setting, but a long-term care. That means to them that this is their house now or home now. We want them to make them feel that they were in a family still.
If some residents, they don't have a family, we have a staff meeting. What can we do with that person? We provide some clothes. We see them like mom and dad.
It really makes our hearts so happy that our residents can appreciate what we're doing for them.
Valerie is an amazing LPN. She works well within our team. She is a good team leader.
Collaboration, I guess, means, in a general term, teamwork.
Like, she's helping on the floor, she's doing the paperwork, she's doing everything that you would need her to do. She's handing out meal trays, like wherever you need her to be, she is there for sure.
What I enjoy so much is knowing every day that I can help somebody make their day better by doing something for them. It doesn't have to be anything big, but just the little things that you stop and do for somebody.
She's very positive, right? She's always positive and always, you know, looking for solutions.
I think maybe that's just part of being a leader, doing the best that you can at what you do.
There was a lot of collaboration during this project between the units, between our dispatchers, between our management and the various other levels of AHS.
We started the project identifying that the wheelchair and the IVACs were an issue. The staff were struggling because they couldn't find them. The units and the customers were upset because they weren't arriving in a timely manner.
They were able to come up with some solutions, and they didn't do it in isolation. They actually had those conversations and connected and reached out to the different services.
So not just delivering an object to the patient, you're helping with the patient care.
The nice experience about this was actually the frontline staff taking the initiative for the change and coming up with a solution.
The result was basically reducing it by half, right, in terms of the potential for waste. Huge.